everyone. Today I'm going to be talking about health policy. So what is health policy? Health policy is how government and policymakers identify specific goals and visions to improve the healthcare system of America. And the ways they improve it are they create complete plans that reach these goals, and these plans have specific steps that must be met, and they have to identify which roles each healthcare personnel has on the way. Health policy also is used to better inform and protect the public, and they allocate federal funds to provide health programs for communities. Legislation's role in health policy is to pass laws created to protect and help the public and make sure that the public's best interest is at hand and not their own. So an example of this is the Affordable Care Act of 2010. This was used to make sure that the elderly and the people in lower classes were protected with health insurance and information. They also control funds for public health programs, as I said before, so they are budgeting which health programs will get money and which will get less money. And they also notice common trends in health issues. So legislation's role is to kind of figure out what medical issue is at the top of their list so they know which health policies will be the most effective and which are most in need. The government's importance is that health policy affects the nation as a whole. So that means the government is affecting the nation as a whole with health policy. And that is important because they've just identified that prevention is key. So the healthcare system across America is now working towards preventing medical issues rather than curing them. The government has the power to fund and create disease prevention and health promotion programs that will improve national health. Such policy and planning decisions have powerful implications for individual behaviors and public health. So they basically have a very powerful meaning so that everybody in the nation is getting the same care and that the public's needs are at the top of the list. But one con that the government may have is that they may implement the wrong policies. So they have to make sure that it's the right policy to the right groups of people. So government may implement an HIV policy for protection, and the funds to have sexual education classes or put them back into schools when there's no incidences of HIV anymore. So they have to make sure that their policies are effective and efficient. So some examples of health policies today are the Health Insurance Portability and Accountability Act, and this is also known as HIPAA, which a lot of you may know. This act basically protects patient information and privacy. So it means that the patient's privacy is at the top of the list for all healthcare providers. So there's always, in hospitals, you might see it says, be wary of your conversation, because you don't want to basically exploit this patient's information when they have no control over what you're saying. And then also, there's the 21st Century Cures Act, which is an act that speeds up the process of discovery and delivery of newly discovered treatments and cures. Their three specific words are discovery, development, and delivery. So they want to ensure, this policy was made to ensure that each person that has a medical issue has the best access and to the new treatment and cures, and that new treatments and cures are constantly being discovered and developed in America. And